Hello everyone, welcome to my YouTube channel. I'm Hima and I make videos on photography, research, motherhood. And today's topic is on hospital bag and things you must do before you get discharged from the hospital and mother guilt. When I packed my hospital bag, it was 3 giant bags and the information over the internet was all over the place. So I packed pretty much everything they said in the internet. After my delivery experience, this is my 2 cents. Don't carry too much stuff with you because the most important stuff that you will have is the one that you'll bring back from the hospital. So don't burden yourself with a lot of stuff because pretty much hospital gives you everything that you really need. And you only stay in the hospital for 2 or 4 days based on the kind of delivery. So the first important thing is the documentation. So as soon as you get admitted to the hospital, they'll ask you for your ID, which will include like a passport or a driver's license. And then you need to have your insurance information ready, as well as a pre-filled form that hospital will provide to you ahead of time. Carry with you some of your essentials such as your eyeglasses, your phone, your charger, a set of flip-flops. Flip-flops are usually the best because even after your delivery you'll have a lot of swelling in your feet, so flip-flops are the most comfortable to walk around. And lip balm, rubber bands, moisturizer, comb, innerwear and a pair of clothes for you to return back from the hospital. Throughout your entire stay in the hospital, you'll be pretty much wearing the robe that they would provide. 3 things that I would say are not essentials but maybe based on your preference. One is socks, the second one is robe, and the third one is camera. Carry essentials for the baby such as a pair of clothes, mitten, blanket. Make sure that you have the car seat in the car. Hospital will provide pretty much everything that you need for the baby: diapers, wipes, nasal aspirator. They'll also provide for your essentials such as blankets, pads. This numbing spray is very useful for the stitches to heal, and you have to use this in your bathroom visits. And the next one is peri bottle. This peri bottle is also helpful to clean. And the next one is this donut cushion. This is an inflatable one. So this donut cushion, it helps you in sitting after the delivery because there will be a lot of pain, and then you can inflate this to the height that you need, and you can put it wherever you want to sit and then sit over it. They'll also provide disposable undergarments, so you don't need to take anything with you, and they'll also provide the birthing ball for labor. So this is something that you have to check with your nurses during the hospital tour. And always bring back home the excess stuff that you have from the hospital because most of these supplies are very useful even at home. So the next question is, will I be provided any food in the hospital? Yes, you'll be provided plenty of food. So this is how it happens. So as soon as you get admitted to the hospital, you'll be provided with a menu. The menu will ask you for your choices of food for your breakfast, lunch and dinner. And usually the timings are around 8ish, 12ish and 6ish. So at these times they'll serve you the food that you have requested, and the food will be delivered pretty much same time every single day, and this will continue throughout your entire stay in the hospital. However, the only issue with this is they only provide food for the patient. If your spouse or your partner wants to have food, then they have to either go to cafeteria or there are a lot of vending machines close by. And also once you get moved to the mother baby unit, there is a snack area where they can have drinks like coffee or tea and water, and they also have some snacks there. The next question is, do they allow the partner to sleep? Yes, there is an extendable couch that will be in the mother baby unit, and then your partner can sleep on that couch. They also provide blankets to you. Also the washroom they prefer the patient uses. So what my husband used to do is he would drive to home, take a shower, have food, and then pick my mother and drive back to the hospital. And usually siblings are also not allowed in the mother baby unit. So some of the things that you must do in the hospital are, first thing is see the lactation consultant. Although you're able to establish breastfeeding, they'll give you some tips on how to enhance the technique, or if you're breast pumping, then they'll provide you instructions on what works the best for you and based on the pump that you're using. Submit your birth certificate to the birth recorder. Meet with your OBGYN and pediatrician because they'll give you instructions on care after discharge. And in a lot of videos online they would say that you can carry pillows, but really there is no time to think about pillows when you're in pain and you're taking care of infant and you are learning so many things. Thing that I did not do but the hospital says is pretty good is to watch the TV. They have a channel for taking care of an infant, and I haven't watched it because there was no time and there's just too much going on, but they say it's pretty good and has useful information. So insurance provides for your breast pump at least in US 6 months before your delivery date. So make sure that you choose the best pump that's appropriate for you. So two things about breast pump. First thing is learn how to operate it before you're going to labor, and the second thing is while you're in the hospital, make sure you meet with the lactation consultants, and they'll give you information on how to use the pump as well as use its settings. Choose your pediatrician before you go into labor, because once the baby is born, they'll come visit you every single day. Make sure to ask the nurse for prune juice, because that helps you manage the constipation. After delivery, you'll be provided with opioids, and one of the side effects of those is they cause constipation. Also, during the delivery process, you may get constipated, so drinking prune juice will really help you. Your first round of elimination will be painful because of episiotomy. Always use a bassinet when you're taking the baby in and out of the room. And those 2 or 4 days when you're in the hospital, don't just sit in the bed. Try to move around and keep that mobility, because it will help you regain strength as well as manage constipation. Wear armbands at all times, because that is a security feature for the mother, baby as well as the partner. And that is what they'll use to bill insurance as well. So they'll scan the code every single time. And during this time, it's a great opportunity for father to learn some of the techniques as well, because they'll be interacting with nurses more than the mother, such as swaddling, burping, putting the baby to sleep, bathing the baby. They can spend more time learning all these techniques from the nurses as the mother is still recovering. Try to drink as much water as you can, because you just lost a lot of body fluids, so you want to help it recover. Use this numbing spray for each bathroom visit. When you're in the hospital, your milk may not come in yet. It takes usually about 3 to 5 days for the milk to come in. While you're trying to establish breastfeeding, in the interim, whenever you get some time, try to use a breast pump, because that will help the milk come in faster as well as keep the stimulation and help the baby latch better. Continue to take vitamin D and prenatal pills as long as you're breastfeeding your baby. Always support baby's head and neck when the baby is small. Another thing that you have to do before you go into labor is make sure you talk with your insurance on what are the things that they cover for. Make sure to go on a hospital tour, because that is when you'll decide what to carry with you and what not. And don't carry too much unnecessary stuff, because you will be having also baby with you. Next one is birth plan. Birth plan is quite exaggerated. Not every doctor asks for a birth plan. However, if you have any specific instructions, as in if you want to give a water birth, if you want specific pain management techniques to be used, and if you have any special requirements, that is something that you need to convey to your OBGYN ahead of time. Also, if you want the umbilical cord to be cut by the partner, then that is something that you can convey to your doctor. And there is a lot of mom guilt when you don't feel that you have bonded with the baby immediately. Every mother is different when it comes to bonding with the baby. Pregnancy and childbirth experience of each mother is very different, so bonding can also be difficult based on the baby's as well as mother's medical condition, especially if the mother has gone through a C-section, or if the baby is a premature baby and if they're placed in NICU. All of these experiences can influence the way a mother bonds with the baby. And despite of the kind of childbirth, all mothers go through pain and exhaustion after delivery, and also so many other things influence your experience with your baby, such as your marital problems, your job status, your financial status, if you had any miscarriages and you don't have a social support system. All of these do influence your bonding experience with the baby. You should not be hard on yourself if you don't bond with the baby immediately, because bonding is a process, and several mothers do experience postpartum depression. So please speak with your healthcare professional if you ever experience anything like that. Things will be much easier once you establish a routine with your baby. So don't let anyone judge your style of parenting. So please don't forget to subscribe, and I make videos on photography, research and motherhood.